Doctor, is it a curable disease, diabetes?
The diabetes is again, we know that there are a lot of medical treatment modalities, many types of the medicines, different types of the medicines, the insulins, and the insulin itself is different types, like the injectables. You must have heard about the insulin pump. Now insulin patch has come. The medical treatment, but now which is, it is proved that the medically the diabetes is not curable disease, because you know that whether when we are taking the blood sugar level, that is the indication that whether you are a diabetic or not. More than that, there is a blood test called glycosylated hemoglobin that will give you a glucose level of in your body for 3 months. So the glycosylated hemoglobin should be less than 6 in a normal person, and it should be less than 7 in a diabetic patients on treatment. But it is proved from various studies, we proved that with the medical treating patients, the A1C level comes down below 7 only in 55% or 45% of the patients. That means with the medicine itself it is not controlled. That's why there are a lot of, when we are the treatment of the morbidly obese patient is bariatric surgery. That means that we are reducing the size of your stomach, and we are readjusting realigning the gastrointestinal tract in such a way that the absorption will come down. So this is called bariatric surgery to treat the obesity. Then one important, one very exciting factor we found when we do the bariatric surgery is that the almost 20 to 30% of the obese patients are diabetic. So when we do the surgery to reduce the weight, before getting the weight reduction, the diabetes is going off. So if that patient, if suppose a 160 kilogram weight patient and his blood sugar is diabetic and on insulin, and after the surgery, immediately after the surgery, his blood sugar comes normal. So that's why the research have started. And what is any other?
I mean, is it without a medical treatment?
Without medical treatment.
Okay, right.
Without medical treatment. So that's why we have started the research, and we found that our intestine, when we take food, there are a lot of hormones secreting, and these hormones plays a very good role in the glucose homeostasis. That means whether your blood sugar adjustment in your so these surgeries now we started using in non-obese patients also. So if your BMI is more than 32 and you are a diabetic, with your bariatric surgery 100% your diabetic will go off, in addition to your weight normal. Then these surgeries, whether we can do it in a normal weight patients. That's why the research now going on. In our center we have done more than 100 patients where the weight is normal. So the initial results are exciting, because you can, that's how.
So that means even after the surgery also they don't have to go for a medical
they don't have to go for the medical treatment. Or many patients who are on insulin, they have come down, their treatment, this one has come down. Many patients are off medicines. More than that, their A1C is coming down below 7 or below 6. That means they are getting well controlled. So that is very exciting, another area of research happening in the diabetes. So we don't know whether after 5 or 10 years we can come, because we don't know. Now we have got these surgeries, have been doing it for 5 or 6 years. In my center we are doing it for last 2 years. So initially there is good result. We don't know how long it lasts. We cannot tell what happens after 10 years. So we have to wait some more time just to tell whether this surgery will be an alternative to the pharmacotherapy.
Okay. So doctor, we'll go to the other question.
Hi doctor, I'm Amrita. I have a doubt. My uncle is obese and he snores at night. What is the solution for that?
I believe, I've answered this question early, because the snoring is one of the effects of the obesity. So in this gentleman, as he is obese, the snoring may be due to the obesity. There are so many other causes of the obesity, snoring also. So with these patients, before definitely he has to reduce his weight. Before going for that, he can have an ENT examination and to see whether there is any other problem. Most probably this his snoring will be due to the obesity only. So once he reduces his weight, definitely that will go off.
So doctor, it was really an informative talk. Thank you so much.
Thank you.
That's all for today. Write your suggestion to us. Our email ID is youthdairyroseball@gmail.com. Bye-bye.